My name is Larry Epstein. I'm the clinical director of the Division of Sleep and Circadian Disorders at Brigham and Women's Hospital. And I am a faculty member at Harvard Medical School and a past president of the American Academy of Sleep Medicine. I got into sleep medicine during my internal medicine residency. At that point, I really didn't know what I was going to do, and came under the influence of a wonderful mentor, Adrian Williams, who was a pulmonary attending. And he was interested in this group of patients who had this kind of interesting problem with breathing during sleep called obstructive sleep apnea. And I thought it was really fascinating and did an early project with him looking at the effect of upper palatal surgery on their ability to tolerate CPAP. And for me, it just clicked. This was something I really liked. However, at the time, there wasn't any way to do training in sleep medicine. The fellowships didn't exist at that point. So you had to do it as part of some other training. So I decided I would pursue pulmonary critical care medicine where there was some place that also did sleep medicine. And fortunately, just at the time I was looking, one of the early pioneers in sleep medicine, Philip Westbrook, moved from the Mayo Clinic, where he had been involved in setting up their program, to Cedars-Sinai Medical Center in Los Angeles to start a sleep program. And so I was able to get a position in their fellowship program doing pulmonary critical care and sleep medicine under the direction of Philip Westbrook, which was marvelous training. And it really cemented for me that this was the career path that I wanted. And so when I started out, as most people did at that point, you had to do sleep as in addition to the other things that you did. So I had to do pulmonary and ICU work, but gradually the sleep portion grew and grew until eventually I was able to do essentially 100% sleep medicine. And I've been a sleep medicine clinician for the last 20 years or so. My involvement with the Academy started basically from the day I started sleep. My mentor, Philip Westbrook, was one of the original founders of the Academy or its preceding organizations. And so when I started my fellowship, it really wasn't a question. He just said, "You are joining the Academy." And so I was a member from day one of doing my training and have been ever since, which gave me great opportunities. As a fellow, I was involved in some of the early product development for the Academy, involved in one of the first sleep apnea slide sets that people would use to educate. It was Dr. Westbrook, Flip Smith from Johns Hopkins, and me, which was a really great opportunity for someone who was just a fellow at the time. And I've been involved with the Academy ever since. Being involved with the Academy has had a great influence. There's sort of the personal trail I was able to follow, which allowed me to both participate and in some small ways influence how the field developed. I've been here as we moved from a side job that we did to becoming an independent specialty of medicine. And so I've been able to participate in that. It's also had a myriad number of positive impacts. So on a clinical side, I've been able to participate in development of clinical guidelines, so helping to influence how the specialty is practiced. It's helped me in terms of participating in education. So I've been involved in and even run a number of conferences for the Academy. I helped start a number of training programs for sleep technologists, the A-STEP program and the college-based programs. And so it's been really helpful there. It's been personally helpful in learning about leadership skills through my participation in committees, conferences, and then eventually being on the board of directors and president. It taught me a lot of the skills that I've been able to utilize other places. And even in scholarship, I've been able to participate in a number of research trials that were funded through the AASM Foundation. I'm involved in a fellowship training program, and they were able to get funding for their projects through the Academy. So it's really influenced the whole array of things that I've done through my career. When I started, sleep was what you did on the day you weren't doing your other job. So you'd do your pulmonary work and then you'd have maybe a sleep clinic. As it grew and occupied more of time, more people got involved. A field of knowledge developed around sleep medicine, and the people involved said, this is its own field. And it was the people involved, the early leaders in the field, Bill Dement, Tom Roth, Philip Westbrook, who really said we need to have our own field. And so part of the strategy of doing that was forming the academy, because you needed to have an organization, you needed to have training programs, educational programs, you need to have a board exam, and all those things came about through the work of the academy, so that eventually it became an independent specialty, a recognized independent specialty. So the process to becoming an independent specialty had several steps. First, there was getting enough people who were interested in it. Once that occurred, then it was providing a forum and a method for other people to learn about it. So educational sessions, scientific meetings, a journal. And then once you had enough knowledge, then there was going to be an exam. This is what we do in our field, is we test everybody to prove their competency. And so the field then set up its own board exam, because we weren't big enough to be under the traditional testing agencies. So the American Board of Sleep Medicine came together and created a sleep test. In some ways, it was more rigorous than the current one. It was a two-part test, where first you did a multiple choice written exam. And if you passed that, then you had a practical exam, which was actually looking at sleep studies. One of my fond memories was going to Columbus, Ohio, where they held the practical exam. And you actually had, this was back in the days when it wasn't on computers, it was on printout paper. These big 900 sheets of pages. And you had 60 or odd people standing flipping all this paper as they were looking through the sleep studies. And so once you passed that, now you were a sleep specialist. But it wasn't recognized by the official organization of medicine. So the steps that were taken to get that recognition was really about the training programs. So the AASM encouraged us to start training physicians in sleep medicine. And then they accredited those programs so that people had to meet certain standards in order to be credentialed. And once we had a sufficient number of those, we went to the ACGME, which was the formal accrediting body for training programs. And it took a little while, but eventually they recognized that this was indeed a separate specialty that required specialized training. And once they recognized it, then the American Board of Medical Specialties said, well, if they're going to official training programs, then they need to have an official test. And that's how the board exam came about. And it occurred during my presidency that we got that recognition. And I had the not pleasant task of informing our membership that, oh, by the way, you have to take another board exam. They weren't altogether happy, but it was a really important step in getting us officially recognized as an independent specialty. The ASM has been a major player in advancing our field in terms of getting appropriate payment and recognition for the specific tasks that we do as sleep specialists. So the process of getting paid is really about getting codes that you can, that's how we describe what we do. We code something and then the payer will say, well, we give this amount of money for that amount of work. And the Academy has been the leader in getting those things for sleep medicine. So the process was, first we had to get recognized. Once we were recognized as a field, we had to get within the body that really deals with payment, which is the American Medical Association. So the Academy had enough members that they could get a seat as an organization within the AMA, which is really an organization of organizations. But it's that organization that then populates the groups that decide about funding. So something called CPT, which is the organization that writes the codes, and something called RUC, which is the group that assigns a value to them. So once we were a member of the AMA, the AASM could then go to those boards and say, this is the work we're doing, we'd like to get recognized for it. And so the Academy was essential in getting our codes for sleep testing, originally for in-laboratory and then for home-based testing, and involved in getting appropriate payment, because that involves surveying your membership to show how much work that we do. And so it is really, all the reimbursement issues really have been led by the ASM. So when I think of my tenure on the ASM board, and particularly my term as president, there were sort of three major issues that we dealt with. First was getting the recognition of sleep as an independent specialty. And that culminated during my year as president. I was not, I'm not going to take credit for it. There had been years of work to get there, but that was very exciting to be there for. The second was really dealing with a lot of issues around sleep technologists. How do we get them appropriately trained? How do we get them appropriately credentialed? How do we build that workforce? And so during my tenure, we really focused on that, developing the A-STEP program to do initial training, joining up with KHEP, the organization for training within colleges. And so we developed those programs, some legislation in states around licensing. And then the third major issue was about home testing. So for years, sleep had really revolved around in-laboratory testing. It was a big driver of the economics of sleep medicine. And it was also the thing that we were able to specialize in and separate ourselves, the information that we got from a sleep study. But technology advanced, and the development of ways that made things more compact, that we recognized we could get some information with less, and that we could do it in a different place. It didn't require being in a laboratory, but it could be done in the home, was kind of developed over a decade or so, and took a while to be tested, shown to be as good for some things as in laboratory polysomnography. And it went through several stages. There was first the introduction of these devices, and the Academy took the lead in assessing whether or not they were adequate for the job that they were doing. Were they accurate? Were they reproducible? And there were a number of evaluations that were done. And the final one came about when there was a group led by Nancy Collop, who brought together people from three different societies, the AASM, American Thoracic Society, American College of Chest Physicians, and really looked at this. And at that point, we weren't sure that it was really, it was pretty close. But the scales got tipped when the Center for Medicare and Medicaid Services, CMS, they felt the evidence was good enough that they could accept sleep testing, home sleep testing, as sufficient to allow us to start treating patients for diagnosis of obstructive sleep apnea. And during my term as presidency, they issued what's called National Coverage Determination Policy, or NCD, that would allow payment for PAP services based on home testing. And that really changed the dynamics of the field to a huge degree. It sort of upended some of the economics of the field, and sleep practitioners really had to shift and change their practices. And I think they've done a pretty good job. On the plus side, it did reduce a lot of the costs. It also expanded access to a lot of patients. We just need the expertise of the sleep physicians to say when are those tests appropriate as opposed to another. And we've seen nothing but advancement in the technology since then. There are more devices, they're getting smaller, they're getting smarter. And I think we are going to continue to see that. Where in the future, probably very little of sleep testing will be done in laboratories and most of it will be done in the home. Sleep medicine is relatively unique in drawing from a tremendous number of specialties. Our members come from internal medicine, neurology, psychiatry, surgery, anesthesia, family practice, and there are very few of any other specialties with that kind of range. So on one hand, it's a real advantage in that we can tap into knowledge of all of medicine to bring to bear on sleep issues, which is important because sleep really affects every organ system. Everything we know about the body is affected by sleep. So that's a big positive. However, it also means that a lot of people are interested in the field. And one of the challenges for the Academy would be how do you balance everybody's desires and how do you work with all the individual people that have an interest. And I think the Academy has done a very good job in that. We have what's called a conjoint board over our exam with all of those specialties participating in it. So they help set the standards for the field. I think maybe the one downside to it is just as we have taken a long time to convince the general medical field that sleep is an independent specialty, we sometimes have that problem with our own members that am I a pulmonologist who does sleep or am I a sleep doctor who has pulmonary training? And I think the more we've convinced people, the more sleep they do, the more they become convinced that they are a sleep person. And I think that's also good for our field as well. Getting sleep-specific training programs has been really instrumental for the field, both in terms of bringing new people in, advancing recognition of sleep as its own specialty, and developing our knowledge base. The Academy has been essential in developing those programs. Early on, it was the Academy precursor that helped set those up and accredited those and set the standards for what is supposed to happen during training programs. That has now passed over, once this was officially recognized through ACGME, to that board, but the people on that are still our sleep members, AASM members who are influencing the field. And it's gone a long way to really solidifying, cementing our standing as an independent specialty, having these training programs. And it's great to see the numbers that have grown over the years. It's been fun to be involved in those. I've been a program director now for more than 15 years, and it's been great to mentor trainees and see them go on to become participants in the field. And so that's been a particular pleasure and joy for me to be involved in that. While developing training programs has been essential for the field, it's had some interesting impacts. On one hand, it created sleep doctors, because that was their training. You kind of identify with what you're trained in. But it also increased a little bit the work to get there. My training was done as part of another fellowship training program. And one of the interesting changes that we saw with the implementation of the new training paradigm was that there was a shift in the people who came into sleep. Originally, it was predominantly psychiatry, neurology, and especially pulmonary medicine because of the impact of obstructive sleep apnea. They were the biggest component of the early membership. When the new board came in, and you could not do, as I did, sleep as part of your pulmonary training, all of a sudden it added another year to training. And I think that became less attractive to people who had already done a residency and then were doing a pulmonary critical care fellowship to do an additional year. And we saw that the number of people who had pulmonary backgrounds coming into sleep dropped. The number of people entering after just an internal medicine residency went up. And neither of which is good and bad, but one of the things that helped sleep thrive was having a broad array of people involved with it. And so part of what we're looking to do now is see how can we sort of open up the pipeline a bit. Because in addition to maybe impacting the types of people who come into the field, we're also seeing it's hard to get the sort of numbers that we need. Demand has gone up. It also takes a lot to get fellowship training programs going. So as we build the number, we may not be getting as many people coming into the field as we need to meet the demand. So how can we look at that going forward and try to improve the pipeline? And the Academy has been very involved in that. They're currently participating in a grant through ACGME to look at innovative ways of providing fellowship training. They got a grant from the ACGME and have now in a multi-year program looking at new pathways. So how do we bring people in different ways from what we're currently doing? One being a part-time model where people can continue to work in their job and also get training so that they don't have to lose necessarily their progress to get sleep training. Or to go back, even though it's looking forward, it's actually going backwards. How can we blend into other fellowship programs, sleep training, so they can come out with multiple board certification? And hopefully that will be accepted as new pathways, and we can continue to attract the number of people that we need to keep the field going. My favorite things about being involved in the Academy, outside of the specifics of things that you accomplished, were really about the people. The annual sleep meeting, I look forward to just as much, if not more, for the people I'm going to see as for the things I'm going to learn. Favorite memories include going to each of the cities that we go to, going to explore the restaurants in the area with the people I haven't seen for a year. I think that's been one of the real hard parts of the pandemic. We haven't seen anybody in a while. And so most of the joy that comes from these meetings is really being involved with all the people. And I've made friends through my involvement with the Academy that have lasted for a very long time. And I look forward to the sleep meetings to be able to continue those. In terms of people who have really had an impact on me, first and foremost, as I mentioned, is Philip Westbrook. He was my mentor, my teacher, my friend. He clearly had a huge impact on this field, being one of the founding members of the Academy predecessor, setting up the organization. Carol Westbrook, his wife, who was the first executive director, because they really took me in during my fellowship years and gave me a career. And so it's been a wonderful association with them. I don't think there's anybody in the field who wouldn't say they were influenced by William Dement. I didn't work with him personally, but he was always there at all the meetings. He was a larger-than-life person. You could see his influence in creating the organization, in going before Congress and getting them to create a National Center for Sleep Disorders Research and put sleep on the map. A driver of all his of awareness about sleep. My wife went to Stanford and took his sleep course. So he always had a huge influence on everyone. Dan Bicey, he was a friend and mentor to me when I was on the board and taught me a lot about leadership and was involved in my progressing up the ranks. So it's been wonderful to be involved with all these people, and most of the people who I think have, once I made this selection for sleep, most of the people who influenced how my career developed were people I met through the academy. Another person who was very influential on me and on my career was Jerry Barrett. He was the executive director when I got involved in leadership of the academy, and was both a big influence on me in terms of how I saw the field, how I interacted with people, how I advanced through the field. He was a dynamic person, and there was nobody better to be in a foxhole with during a fight. But he was committed and passionate about our organization, and his real tenet was that sleep people should decide what happens about sleep medicine, and really promoted that. And I think that was a huge part of the success both of the organization and the field. So he was also a big influence. The AASM is the professional organization representing the field of sleep medicine. But it also is, to me, kind of a professional home. It's the place that has been, or it's the group that has been with me through everything. So even when I switched, it was part of what I did as my training program. When I'd switched jobs, I was still going to the academy. It has had an instrumental part in helping my career advance, and most of the professional colleagues I have and friends I met through the academy. So it's been a wonderful place for me personally, and I have nothing but warm feelings about the organization.